introduce myself. My name is Dr. Bryan Davis. I'm a clinical health psychologist with the Norton Neuroscience Institute. This is the mental health holiday series that we are doing here. We thought it would be a really good idea. Things around the holidays are always a little bit stressful, and this year is no exception. Probably even more with everything going on in terms of the pandemic, and then here we are planning for holidays. So stress levels can be high, mental health symptoms can be high. So we want to come in and share some information and do this every day this week. So at 12 o'clock every day this week, we're going to be talking for about 10 to 15 minutes about specific topics. This afternoon, we're going to talk about stress. I think it's a really good place to start. On Tuesday, we're going to look at mood and anxiety. Wednesday, we're going to talk about communication. Thursday, we're going to talk about sleep. And then Friday, we're going to talk about mindfulness. So a nice build up towards the end of the week. But today, we're going to talk about stress. And this is something that's always really around, but we always see this kind of ramp up around the holidays because the holidays can be really stressful. This year, especially with the pandemic, it adds an extra layer. But what I wanted to share today was to share more information around stress, what it is, how it affects us, but also what we can do with it. So I'd like to provide some context around it. Realistically, stress is something that is highly normal, and actually we're really good at having it as human beings, and that's an important factor because as humans, we've needed stress to stay alive for the millions of years that we've been around. So our bodies are naturally very, very efficient and very, very good at working with stress and doing something with it. It's so good at it that it actually does it automatically. So we have a process in our body, it's called the autonomic nervous system, that actually turns on and does all these things physiologically, which then creates a certain state within ourselves that we must then react to. A lot of times this goes on without us even realizing it's happening, and we're under a state of stress that's relatively high, and we don't realize it, and it goes on for a long period of time, which can actually have negative effects on our health, on our mood, on our relationships. So what I want to do today is talk to understand stress, contextualize it a little bit more, and then we'll get into some coping skills and strategies that we can utilize over the holiday season to help out. So first, when we talk about stress, there's a lot of things going on. So there's the environment, there's our mind, there's our thoughts, and then there's our physiology, or what's going on physically within our bodies. So when these things happen, what happens is something happens outside that's a highly stressful event, or maybe it's you're in a situation. What's happening is it turns on a certain system in our body is called the sympathetic nervous system. So what happens is information comes in, and our body is just trying to do what it thinks it should do. So when stress hits, it turns on our sympathetic nervous system, which turns on the fight or flight response. And this is very useful, actually, in short-term circumstances. So, for example, if this room caught on fire, my body would pump a lot of blood to my muscles, my breathing would change to breathing a lot of oxygen, my pupils would dilate, so it would make me more vigilant. Very helpful if I'm trying to escape a fire. But then what we want to happen is we want that system to turn off when there's no more emergency, there's no more stress. In order to do that, we have to actually do something with it. And if we don't, then that sympathetic nervous system will stay on when it thinks that we need to. So if we maintain that state of stress, our body will follow. So what happens when that sympathetic nervous system is actually turned on is physiologically, what's happening is your blood pressure is increasing, your heart rate is increasing, your breathing is increasing, trying to get more oxygen to the muscles so you can do the fight or flight response. So it's using a lot of specific energy to help you escape. So think about this in terms of like evolution. Millions of years later, we're still following these pretty simplistic processes to keep us safe. But opposite of that, our immunity, so our immune system during that time shuts down. Our GI tract shuts down. So if you've ever been really nervous or stressed out and your stomach is doing weird things, or maybe you've been really stressed out, you've gotten a cold or you've gotten sick, These are the reasons why, because that sympathetic nervous system is turned on most of the time. Therefore, it's not it's not using the resources that it would use for your actual body systems that are really helpful. So the good news is that with that going on, if we build awareness around that, we can actually do something with it. And I think this the context around stress, the fact that it is a normal thing, our bodies are really good at keeping us safe. That's actually a pretty comforting thing, and I think that knowing that this is normal and our bodies are really efficient at this, we can then validate our experiences and not kind of self-blame. Oh, here I am stressed again. Here I am stressed again. Well, your body kind of wants to protect you, so your body's really good at doing that. When we can follow these cues and recognize when that's happening, we can change certain behaviors to then turn on a different part of our autonomic nervous system, which is your parasympathetic nervous system, and that relaxes your body. It turns off all the other parts that we recently talked about. The main factor that controls that is how you actually breathe. Okay, so as I said before, when our sympathetic nervous system is turned on, what's happening is our breathing is changing. We're breathing very fast. When you're stressed, when we're anxious, all these things, we hyperventilate. And when our breathing changes, our body follows suit going, I think this is a time where we need to turn on our sympathetic nervous system. Well, when we can control our breathing, your body does the exact thing, except in the opposite. When we breathe slower, we breathe more deeper breaths, our body then naturally turns on our parasympathetic nervous system, which is going to reduce blood pressure, reduce the strain in our heart, it's not pumping so hard, reduce muscle tension, keep that immune system churning, keep that GI tract churning, and keep all these healthy processes in your body in more of a homeostatic space that's going to be really helpful and productive. Therefore, we see mood symptoms decrease, we see illness decrease, we see a lot of other things that are not so good decrease. Let's talk about what we can do in terms of the breath and breathing. Interesting fact, an individual that breathes more than 12 times per minute is actually in a hyperventilative state, which is probably really surprising to a lot of people. When we think of hyperventilation, we think about a bag over our mouth and just breathing and breathing and breathing. Well, a hyperventilative state simply means that you're keeping your sympathetic nervous system turned on. And what we found is just over 12 breaths per minute, so breathing between that 12 and 20, which is very common, breaths per minute, you're actually activating your sympathetic nervous system. So all those factors I talked about in that waterfall situation, blood pressure, heart rate, muscle tension, all those things are staying on. And when we talk about stress, chronic stress, that's what we're talking about. So all those systems remain on just by a factor of, how often and how we're actually breathing. So a fun fact with breathing is, we can do a lot in terms of, and it goes a long way, but it's actually pretty simplistic. Because again, we're talking about stress and our sympathetic nervous system and fight or flight response. These are all things that have been going on for millions of years. So there isn't necessarily a quick fix to this or an app or a supplement or anything like that. It's simply how you're breathing. So if we can change that, we can do a lot of positive things. So when we're stressed out, we're doing a lot of short, shallow breaths. So we're breathing a lot per minute, and so we think breathing more, we're getting more oxygen. Not necessarily. What's happening is you're breathing more. You're breathing so fast that you're taking in a lot of oxygen, not letting the natural process of oxygen to carbon dioxide happen, and you're kind of activating and stressing your body out even more. So if we can recognize that when we're breathing, we do a lot of shallow chest breathing. So if we actually can counteract that, what I like to do with patients is put one hand on your chest and one hand on your stomach. What we want to do is breathe less from here and more from here, which is your diaphragm. Your diaphragm is a muscle on your abdomen, and when that actually expands and turns on, it starts to actually notify your body to turn on the parasympathetic nervous system, which is going to relax your body. And it's all done via your breath. So if we can do that, use more here and less here, you can actively turn on your body system, which is going to help relax you. And just a quick tool that we can do is, if you do this for 10 breaths, if you do 10 breaths of using your diaphragm, when I say breaths, I mean breathe in through your nose, out through your mouth, using your diaphragm. What you're going to do, if you just do 10 breaths of that, it's going to take you maybe a little over a minute. And if you can do that 3 times per day, you're actively physiologically changing your body throughout your entire day. And what you're doing is you're increasing self-check-ins, you're increasing self-awareness, and you're relaxing your body. What I like to tell people is, at the beginning, you might not be very, very, very good at this or remember to, actively try this out. So you can do things. You can set alarms on your phone. You can set an alarm for 9 a.m., 1 o'clock, 6 o'clock, or, you can do this 10 times per day. You can't do this enough, right? So you can do this as much as you need to. But I like to say, if you start with 3 times per day, again, you're activating a self-awareness, a self-check-in, which is going to be really helpful. And if you do, what we find is that, when I see patients here, we put on a pulse oximeter. So this is biofeedback. So when I have patients practice this deep breathing for just 10 breaths, what they do is their heart rate drops, their blood oxygen levels increase, and their breaths per minute decreases. So basically, you're breathing less, but you're getting more oxygen. So the deep breathing, it sounds counterintuitive that you want to breathe less to relax and feel better, but that's actually what's going on. So when people do this process, they bring their breaths down from maybe 15, 16, 20 breaths per minute to 7 or 8. And they completely change themselves physiologically, all within a minute. So I think these are things that we can practice and get really good at. And realistically, give yourself, a couple of weeks to practice this and stay consistent with it. And these are things that are going to really change your overall mood, your overall stress levels, help with immunity, help keep you healthy, help keep you happy. These are all things that are so important as we enter, the holiday time, which is usually a pretty happy time, but can also be a relatively stressful time too. So make a routine of this. When we can make a routine, we can plan ahead. So when we plan ahead, we kind of take this time to kind of exercise these deep breathing skills. I think this will be really, really helpful. Other factors that can really help with stress is, of course, leaning on your support systems, talking with friends and family that are very helpful. But it's also, if you're already doing things that are really helpful, you're already on a good routine, try to do your best to keep that routine. So we can add into the routine with the deep breathing skills. But if you take walks, if you exercise, if you read books, if you do things that you highly value and are really helpful for you and your stress levels, try to maintain those. Because what happens around the holidays is things get kind of chaotic, things look different, things change. We get off of our routine. So anything that you can do to maintain is going to be really helpful. So exercise, reading, walking, music, whatever works, continue that. And I think whether you are already practicing the deep breathing, adding this in, I think this is a good, healthy habit that are always going to help with stress levels. And again, when stress levels are down, we usually see mood symptoms down too, which means you're happier, and you're able to be kind of more of yourself and enjoy the surroundings around you, which is so important around the holidays. It's what they're there for, and we want to make sure that happens. So in terms of stress, that's about all I have for today. And again, this is installment 1 of the mental health holiday series, and we'll meet back tomorrow at the same time, and we'll talk about mood, depression, anxiety, and we'll kind of keep going throughout the rest of the week. So thanks for joining today. I really appreciate it, and we'll see you soon.